Thank you. Great to be here. Great to see you all. So you've been how many hours have you all sat this morning? It's a little bit. So what I'd suggest before we start, I'd like to just spend a couple minutes doing a routine that one of my third grade teachers uses in the worst school of Brooklyn, and half her boys have ADHD. And pretend you're 5 years old, and this is a giant adult Simon Says. Experience is the best teacher, so if you all stand up. Yeah. Get a little space around you. And just start shaking. The kids call this ragdoll. So your arms are really relaxed. They just move because you're going up and down with your legs. Don't use any muscles in your arms. Just let your shoulders relax, your head bob. And most of these kids have incredible amounts of stress and a lot of domestic and drug abuse at home. There's some additional ways to let some stress out, and that's to make noise. So just imitate the noise. And relax, close your eyes. Observe the changes in your body, in your mind, in your breath. Now, kids also have to yell. And when I was a kid, we had recess and we had physical fitness, John F. Kennedy's physical fitness program. All that stuff has been cut out in most schools. Okay? So it's really helpful to yell. So imagine you're on the playground and you're going to yell "ha" with me as loud as you can, and no adult is going to tell you to be quiet. And what you're going to do, there are different movements we could use to send energy to different channels of the body, but you're going to breathe in and bring your elbows back with your palms out and go, "ha!" Almost like you're shaking water off. Let's do it together. Breathing in. Ha! 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 Louder. Ha! That's better. Ha! I know you have stress. Ha! 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 Two more. Ha! Ha! Relax. If possible, close your eyes or partway close them. Observe the changes in the body. Where do you feel the energy moving most? Changes in your mind. Changes in your breath. And why don't you sit down a moment? I'm going to do a little breathing in a particular rhythm. How fast do healthy, normal people breathe according to medical textbooks? About 15 to 20 breaths per minute. So we're going to breathe at 5 breaths per minute. So the sympathetic and parasympathetic branches of your autonomic system are evenly balanced. So you're going to hear a high tone. We'll breathe in on the high tone. And when you hear the low tone, you'll breathe out on the low tone. So close your eyes if possible. Patients with PTSD or severe trauma may not be able to close their eyes for quite a while. There's the high tone. Breathing in, your belly expands. And breathing out, your belly contracts. Breathing in, the belly expands. Breathing out, the belly contracts. If possible, in and out through the nose. Breathing in, a subtle energy fills the body. Breathing out, your body can relax more and more. Breath in on the high tone, continuous, effortless breath. Breathing out, relax your eyebrows, your face, your jaw. If it feels like it's hard to go the length of the chime, breathing in or breathing out, just pause your breath for a second or two. It's just some old stress getting in the way. Breath in. Breath out, relax your hands, your arms between your shoulder blades. Breathing in. Breath out, relax your lower back, your belly and hips. Breathing in. Breathing out, relax your legs and feet. When your mind wanders, come back to the chimes and awareness of the breath moving in your nose and throat. Breathing in on the high tone, breathing out on the low tone. When your mind wanders, bring it back to the feeling of the breath moving inside. And whatever thought or memory or sensation comes, just let it pass by like a cloud in the sky. When you're ready, you can open your eyes. So do you feel any differently now than when you came in? Yeah. Big change. So one of the things you did was you improved your heart rate variability, and that improves your frontal lobe executive functions. In fact, everything pretty much measurable in the brain and the body gets better after doing that. Okay, no financial conflicts. We use many products. We don't take any contributions from any companies because it would be a conflict of interest. So you know these stats, I'm sure, but 5% of youth have ADHD. Boys are diagnosed more than girls. Girls tend to have more inattentive type ADD with more anxiety and depression. And at least 50%, if not more, of patients continue into adulthood with significant associated problems. And these are some of the disorders that you're used to seeing in kids and adults with ADHD. And about what percentage of kids with ADHD have learning disabilities? Take a wild guess. Probably at least 40%. Okay? I think it's more like 50%. It depends on how good a psych testing you have. So, external factors we'll talk about: food and additive allergies, metals, mineral deficiencies, fatty acids and lipid issues, amino acids, diet, B vitamins, and some other issues. So 2 studies on parents getting CAM for their child around the same time. 38 to 54% of the parents doing alternative stuff. Diet varied greatly, how much they were doing, and these were done in different parts of the country. And vitamins about the same, other things. And note, a small minority told their doctors they were doing this stuff. One study, very small study, 10 kids on Ritalin by choice, 10 on supplements, using a standardized continuous performance task, equivalent improvement in both groups. Do I think stimulants work well for a lot of kids? Absolutely. They have the best effect size of any psychotropic drug. They work better. But I see in my practice the ones who don't have enough improvement, and indeed the stimulants only work on part of brain function, and the ones who can't tolerate stimulants even if they work, the ones for whom the stimulants don't work, etc. And animal data indicates that the stimulants improve focus but diminish creativity and playfulness. That's not been studied in humans. Okay, a lot of stuff on iron. In one study, 53 kids, aged 4 to 14 versus 27 controls, low ferritin levels in 84% of the ADHD kids, far more, almost 4 times more than the control group, and the level of low ferritin correlated with cognitive deficits and more severe ADHD symptoms. And that's a little bit complicated by the fact that an iron deficiency can be associated with restless leg syndrome. But my feeling is that's not often the case in clinical practice. Okay. Iron is a cofactor in the synthesis of dopamine and affects dopamine receptor activity. So in one controlled study, published by Konefal, 23 kids, low iron ferritin and iron supplementation, 80 milligrams a day, improved ADHD. You can go to that article to read further on it. And low ferritin in another study correlated with baseline ADHD symptoms and the dose of amphetamine required for improvement. Zinc is also a cofactor, but in serotonin and norepinephrine transmission. So the two transmitters that have been most studied in ADHD are dopamine and norepinephrine. But zinc is also crucial for the effect of melatonin, which does many things in the brain and the body, and also free fatty acid metabolism. In one study, randomized 209 seventh graders, about half of them girls, 0, 10, and 20 milligrams of zinc or placebo for approximately 12 weeks. 20 milligrams of zinc improved speed and accuracy on testing. There was no correlation with blood zinc levels prior to treatment. So intracellular levels and effects may be quite different from blood levels. The girls in the placebo group during the time of the study had a 10% increase in conduct problems, whereas the girls on the zinc got better in their conduct. There is some data that zinc levels tend to be low, especially in ADHD boys. Okay, some more studies. 328 boys, 72 girls, in a placebo double-blind randomized controlled trial of zinc, 40 milligrams of LML zinc or placebo. This was done in Turkey, and the Middle East has a low zinc level in the soil. A lot of the world now has low mineral levels in the soil. The zinc really helped hyperactivity, impulsivity, and poor socialization, did not help attention deficit symptoms, and was correlated with low zinc and free fatty acid levels. And a low zinc level has been shown to impair response to amphetamine. The US studies are more mixed, probably because we do have more zinc in the diet than in many other countries around the world. This is a study done in Iran by a very good group I know there. 44 children for 6 weeks getting placebo or 15 milligrams of zinc a day added to their Ritalin, and the zinc plus Ritalin group did much better than zinc plus placebo, and it's well tolerated. This needs to be replicated. Okay, food additives and hyperactivity. A lot of confusing studies, most of them not well done. The best study came out published in 2004. 277 out of 1,246 kids on the Isle of Wight in a complex 4-week double-blind crossover study getting either usual food additives or placebo for 2 to 4 weeks with a washout in between. And parents always knew when their kids were getting the additives because they could tell when they were hyperactive. The psychologist, seeing them for a few minutes in the clinic, couldn't tell when they were on additives or regular food or whatever. And there have been 8 studies from 82 to 2001 trying to see if removing dyes helped. Let's say, I think that's more important, sugar restriction. I think the problem with doing sugar studies in our culture is you can't keep kids from having sugar, even if the parent tries to do it at home. All those studies are confounded. So, but what's interesting is in a recent review, it looks like a subgroup of kids with ADHD are quite sensitive to additives and can benefit from diet. And a recent meta-analysis of these controlled studies showed that 33% of kids with ADHD do have a modest response with an effect size of about 0.5 from going off dyes and synthetic food coloration, which are carcinogenic and neurotoxic anyway, but I'm not getting into that today. It's also exciting to know that a difference in polymorphisms of histamine degradation occur at a higher rate in kids with ADHD, and that's related to dopamine 1 receptor polymorphisms as well. So these kids have much more worsening of their clinical symptoms when challenged with the dyes than kids who don't have those polymorphisms. So they can't have the same level of histamine. And you can read more about that. That was published in the American Journal of Psychiatry in 2010. Omega-3s, a meta-analysis shows a small, but overall significant improvement on children with omega-3 fatty acids. It's not great, but every little bit helps. I mean, what's the difference in gold, silver, and bronze at the Olympics? A few percent. A few percent might be important for a particular child. And the higher the dose of EPA in the range of 600 to 1,000 milligram a day correlated with the reduction in symptoms. Schoenthaler's done a bunch of studies of vitamins, particularly B vitamins in kids. In this study, this was done in Arizona in a lower class area, a lot of mixed ethnic groups. 245 working class kids, 6 to 12, double-blind, randomized, placebo-controlled trial, have high B vitamin content for 3 months, a net gain of 2.5 nonverbal IQ points in the B vitamin group versus placebo. The girls especially did better, actually. I use a lot of BioStrath. How many of you know what BioStrath is? So hardly any of you. So BioStrath is a traditional Swiss herbal tonic that has 33 huge controlled double-blind placebo trials. It's a special preparation of brewer's yeast and has effects that no vitamin has, although brewer's yeast is high in vitamins. So it's a brewer's yeast that's grown on beds of 20 medicinal alpine herbs. And it's been around for several hundred years at least. And they've done 4 studies in kids. One of the most important one was in 123 kids with mental retardation. And you get significant improvements on it. I take it myself. The psychiatrists I supervise take it themselves, put their kids on it, and say it's the most important thing they ever learned from me. You can get it in drops for little babies. You can get it in liquid or tablets. Anyway, amino acids, they don't do a lot. And if they do something, they wear off after 2 weeks. My feeling is you got to show me some more data on this. Doesn't do anything. How many of you know about dimethylaminoethanol for ADD? Okay, so a lot of parents pick up the stuff in the health food store. 6 studies by today's methodology would be considered really poor, but back then they were okay, comparing it to Ritalin or placebo, mild effect. But more importantly, centrophenoxine was made by a famous biochemist, and I knew him. He came out with it, I guess it was around 60. There are thousands of studies on this, controlled studies. It's one of the best studied medications that's called a nootropic to help learning. It has multiple effects on the brain. He had the brilliance to combine the DMAE with a plant growth hormone, which enabled it to get across the blood-brain barrier and into nerve cells like dopamine, cholinergic, and other much better. And it definitely increases choline levels in the brain. It helps not only neuronal in numerous transmitter systems, but glial cell metabolism. It stimulates the reticular system. It improves the fluidity of the nerve cell membrane, so the transmitter, receptor-transmitter ligands can work better. And it pulls out lipofuscin, in other words, protein garbage that builds up with age. And that's very important if you're older. So I have a lot of older psychiatrists come to see me for age-associated memory impairment, specifically for this. And it's synergistic with ginkgo and synergistic with certain other nootropics, like piracetam and other racetams. So I use centrophenoxine a lot. The racetams, or the chemical name is pyrrolidones, but that's hard for most consumers and some professionals to say. There are 4 main ones with thousands of studies. Piracetam was the first, but kids have to take a lot of it. I tend to use pramiracetam, aniracetam, and oxiracetam, depending on what's available on the market. Pramiracetam also helps anxiety. I was involved in a study of that many years ago, showing it helped people respond to ECT faster. The drug company didn't consider that a good marketing point and never gave us the data to publish. Anyway, it acts on numerous things in the brain, including helping long-term potentiation. It helps different parts of the brain communicate and connect with each other better. It activates especially the verbal areas in the left hemisphere, both receiving and expressing, and writing and reading areas in the left cortex. And it's synergistic with centrophenoxine, caffeine, CDP-choline. And there are numerous studies showing it helps antidepressants work better, and that it also kind of can help memory loss in kids or adults on anti-seizure medicines. These are very under-ignored drugs, came out many years ago in Europe. They're almost natural, both the centrophenoxine and the pyrrolidones. In their chemical structure, they're very close to chemicals that are crucial for these functions in the brain and have hardly any side effects at all. But the drug companies there never had the money to bring them out in the US. This is one large study of piracetam for dyslexia. And what they showed was after 3 months, there was a significant separation from placebo. And I find it helps processing disabilities on neuropsych tests in kids with learning disabilities of processing, auditory, verbal, whatever, visual. And by the way, these drugs are also good for post-stroke recovery from aphasia in the context of verbal remediation post-stroke programs. So they have multiple uses in psychiatry. Other effects post-concussion, and they are, as I say, totally non-toxic. SAMe, acetylmethionine, clearly delays brain aging in rat studies, and there are a bunch of studies showing it's good in mild cognitive impairment, early and late-stage Alzheimer's, if combined with acetyl-L-carnitine and N-acetylcysteine, helps monkeys recover better post-stroke, and good in post-concussion syndromes. That was a controlled study. In one small open series, 2,400 milligrams a day of SAMe improved symptoms. The only patients who didn't respond are ones who failed to respond to Ritalin. SAMe works on dopamine and to some extent on norepinephrine and a little bit on serotonin. Okay, my wife and I both use rhodiola. We published our first article on this in 2002. Within a month, the number of publications on rhodiola skyrocketed and continues to rise. It still has not plateaued. Rhodiola was studied by the former Soviet Union, scientists in the space program in particular, and they were looking for things that help people perform better under stress. Space is the most stressful environment man or woman has ever been in. And many people have almost died, as well as the ones who have died going up into space. So the Russians were very interested in finding something that would make their brains and bodies work better. And rhodiola does stimulate the reticular system and increase levels of dopamine, serotonin, and norepinephrine, and does work on the cholinergic system, including a lot of smokers find it reduces their desire for cigarettes. And it reduces the amount of cortisol. Your stress response system doesn't turn on as easily. It turns off more quickly, and you have more reserves. And it increases ATP and creatine in all cells of the body, and all organ systems work better. Less hormone levels are needed for it. And there are numerous studies, 11 randomized controlled trials in psychiatric symptoms, including fatigue and mental performance and physical performance. I'm not going to review them all here. You can read some of the stuff we've done reviewing this. So it improves attention, accuracy, especially under great stress, memory function, abstract thinking, color perception, and other functions. This is one diabolical test. This would not get through an IRB in the US. Okay? They're really stressed. 120 students kind of given a matrix correction test. And you can see the placebo group an hour after starting has 13% more errors. The rhodiola group has 4% less. At 4 hours, the rhodiola group has 56% less errors, and this is just a one-time dose of rhodiola. The placebo group has 37% more. At 6 hours, the placebo group has 88% more errors. The rhodiola group is kind of back to where they started at baseline, and the placebo group wants to kill the experimenters. Okay. This was to try to replicate what it's like in space. In space, there's tedium and boredom punctuated with life-threatening situations, and they combined rhodiola with schizandra and Siberian ginseng. And much less fatigue, better alertness, fewer errors, better memory, attention, coordination, better work attitude, and less eye fatigue and eye irritation working on computer screens for hours and days. A lot of these studies, by the way, were secret and classified, and still are, actually. This was college students given low-dose rhodiola or placebo, 40 subjects for 20 days of final exams in their first year of university in Russia from foreign countries, significant improvement on all measures, physical and mental and neuropsychological, and better final exam marks. Anyway, another study in foreign high school students studying in Russia. Okay, ginkgo, that's how the leaf looks when it's dried. Meta-analysis indicate that ginkgo improves selective attention, fluid intelligence, memory and executive functions, and processing speed compared to placebo. And those are things often impaired in ADHD. One study, pilot study, and another one of 6 weeks of a double-blind placebo-controlled study. Ritalin was more effective than ginkgo TID, but those who know how to use ginkgo would have used a bigger dose of ginkgo. I'm not saying that ginkgo would be as good as Ritalin, but it may allow you to lower the dose of Ritalin, especially in a child with a lot of side effects. It does activate the brain in brainwave analysis like Ritalin. This was a study doing American ginseng and ginkgo, and I would rather use not ginkgo alone, but ginkgo with centrophenoxine and American ginseng. There are several large controlled studies, including one in schizophrenic patients, showing American ginseng helps working memory. And your working memory is important for solving complex problems. And you can read more on this. Melatonin for insomnia in kids. So ADHD parents often have a terrible time with their kids' insomnia. And in this study, a well-done study, double-blind, placebo-controlled, randomized group, 5 milligrams of melatonin at 6 p.m. versus placebo. The kids were 6 to 12. They had a year of chronic sleep onset insomnia, and they were monitored for a week at baseline and got 4 weeks of treatment. The melatonin group fell asleep an hour earlier and slept 40 minutes more. That's better than Ambien. That's better than benzos. Okay? These kids did much better. Another study. 4 weeks, 105 kids, sleep onset insomnia with ADHD. Significant improvements, falling asleep faster, staying asleep better. 3-year follow-up, 65% were still on melatonin, 12% used it occasionally. That's voting with their feet, at least the parents voting with their feet. Long-term melatonin was effective in 88% of the kids, and parents reported improvement in 70% by 4 weeks and mood in 61% the next day. They're generally calmer and quieter. No adverse effects. Pediatric doses, kids under 40 kilograms, in the range of starting 0.3 to 1, maybe up to 3 milligrams. Children over 100 pounds more likely to need 3 to 6 milligrams. And for some kids, if it's just trouble falling asleep, a quick release brand, like one that's sublingual, may be the best thing. If they have trouble waking up during the night, then the extended release might be better. And some formulations on the market put together both quick onset and sustained release melatonin. A lot of kids with autism have ADD, and also kids with autism often have seizures. So this was, again, a double-blind, placebo-controlled study. And all the kids improved in sleep and were less irritable, more alert, more sociable. And the 3 epileptics in these 15 kids had better seizure control on melatonin. And that's been reported by many child neurologists and psychiatrists using melatonin long-term. Another study, showing basically the same thing. Okay? Baseline low salivary melatonin levels in these kids. 8 out of 10 got better. 2 non-responders had low doses. We would have dosed them higher. And 6 out of 8 responders had increased seizure control and regained normal patterns of melatonin secretion. Autonomic nervous system biofeedback. I refer hundreds of patients for biofeedback in a year. I find it's extremely helpful in ADHD if someone knows how to do more sophisticated biofeedback. Not all biofeedback works for every kid. So you need to, I like a practitioner who has different methods because they often differ. But in this one open study, improvement correlated with improvement in heart rate variability. It's very clear from other studies, not using biofeedback, not using some of the other things we'll talk about. You improve heart rate variability, you improve autonomic system input to the frontal lobe, and executive functions improve. Meditation, Arnold reviewed this in his review published in 2001. 2 controlled studies showing ADHD kids improve with meditation. I've never had an ADHD kid able to meditate. I don't know where their populations come from, but I get the ones that have failed everything. So I'd say I put this more for academic interest. It's out there. But I do other things for kids. I just find they don't do meditation. I'm sorry. They're just all over the place. You got to get them doing a lot of other stuff first. This is interesting in that vestibular stimulation helps with ADHD ratings, and it stimulates vagal input to the brain. And there's a lot of ways to do vestibular stimulation. How do kids do vestibular stimulation? They get on merry-go-rounds. They get on roller coasters. They roll down hills. And Sufis do spinning. And I teach Aikido. We do a lot of spinning. In ballroom dancing, women do a lot of spinning. Men less, very little. Okay. Yoga. Many studies of yoga. I won't go into great detail on these. And I know I'm whipping through this quickly, but I want to give you time for questions as well as any other stuff we want to do. This is the first published study from a group in Australia working with ADHD kids, 19 boys, 8 to 13. They did a program which had a lot of breathing in it. I find the breathing is more important than the postures and meditation, whatever. Significant improvements, and the degree of improvement correlated with how much practice time mom did with them at home. Second study done by a German group, randomized controlled study, 19 kids. They had 20 groups, 1 hour a week, or a conventional program of basically calisthenics over a 34-week period. The yoga training was as good in effect size as Ritalin. And there were issues of attendance and all that kind of thing, but it's actually pretty exciting. This was done by Shirley Tellis and her group in India. Executive control function improved in kids doing 1.25 hours per day of yoga for a month. On the Tower of London test of executive frontal lobe functioning, they did another study in incarcerated kids, and they were also studying adults too, with better sleep, appetite, well-being, and decreased arousal over a 6-month period. In another study, several studies actually, they had 30 kids doing breathing, postures, meditation, and singing 8 hours a day for 10 days. And they had another kids doing drama, dance, singing, and painting for 8 hours a day for 10 days, and 30 kids with no intervention. And the yoga group did best, especially in spatial memory. Did not affect verbal memory. Okay. Autonomic nervous system changes in ADHD and antisocial disorder and conduct disorder. Basically, kids with these disorders have a greater or lesser degree of autonomic nervous system dysfunction, where basically both the sympathetic and the parasympathetic system is half asleep. I'll talk more about this in the next lecture on mind-body practices. And basically, kids with ADHD don't respond to aversive stimuli that much. They don't respond to negative reinforcers that much. They don't respond to punishment as much. Their brain is half asleep. And that's important. It comes alive when they're doing risky and forbidden things. It's very reinforcing when they do those things. Okay. Respiratory sinus arrhythmia was an old-fashioned way, occasionally used these days, of assessing the activity of the parasympathetic branch of the autonomic system, which is really crucial to your brain functioning better and your executive frontal lobe function, for one thing. And healthy babies have a high respiratory sinus arrhythmia, and they can respond much better in every way. Low respiratory sinus arrhythmia is found in depressed, timid, or fearful children, and found in most psychiatric disorders. And the older you get, the more impaired autonomic nervous system function you have and poor respiratory sinus arrhythmia. So lately, because it's also a dirty kind of measure, it's a complicated measure, heart rate variability measured from an EKG and a Fourier transform of the beat-to-beat variability gives a better measure of parasympathetic tone. In interesting work with children, boys with better respiratory sinus arrhythmia are more empathic under stress and are better socially competent. On average, girls have a much higher respiratory sinus arrhythmia at baseline than boys. But guys, you can learn. Okay, so aggressive and antisocial adolescents show, because they have deficiencies in both sympathetic and parasympathetic, they have decreased heart rate and decreased respiratory sinus arrhythmia and decreased heart rate variability. And this is crucial for your ability to not only solve problems, but your ability to mentalize and feel other people's feelings and bond with other people. And again, this is a more extensive study of these kids. These are 3 studies that looked at this more closely. And the more you're on the antisocial spectrum, the worse it gets. And this is a simplified wiring diagram. Basically, 80% of autonomic system inputs come from the viscera, the deep viscera, go to kind of nodes in the brainstem, and then go up to the limbic system and through the thalamus into the brain. And the thalamus constantly is regulating how the cortex is organizing things. And the thalamus has been, even now, relatively ignored in the teaching of neurophysiology in medical school. And we know a lot about how vagal nerve stimulation works from implants in animals and humans. And it definitely makes your brain work a lot better, as well as helping your mood. And it also releases anti-stress social bonding hormones like oxytocin and prolactin. I'm not, again, going to go into it in great detail. It just makes your brain work better. But you can do the same thing with breathing or spinning. But breathing you can do anytime, anywhere. Spinning, it's a little hard to do. This is another double-blind randomized placebo-controlled trial, 102 kids not on medication, and they did theta-beta training and a block of also slow cortical potential training, which is a newer development, versus a computerized attention skill training program, and the neurofeedback group did much better with an average effect size around 0.5, which is nice. This is another study of neurofeedback, 6-month follow-up, superior scores in the neurofeedback group, and they got a lot of decreased theta activity instead of beta that correlated with the improvement in symptoms, as well as improvements in alpha in the occipital cortex from the slow cortical potential training. And anyway, you can learn more about this by going to the website for the International Society of Neurofeedback to learn more about that. Most of my patients are significantly better around 3 months. And again, there are different ways to do this and different ways to measure how the brain is not working optimally.